Can surgery lead to more pain afterwards? It's a question people are wondering when they're faced with surgery. Of course they are. And the short answer is yes, it can. The longer, more complicated answer is yes, it very much can. There's a few reasons as to why this happens. One, you're cutting into tissues, and there's always the risk, the potential, even the inevitability of some level of nerve damage. That can lead to nerves that are just constantly hurting, and they can be hard to shut off. But that's not the only factor that's going on. There's also tissue damage that has to now adhere, repair. It becomes what we call myofascial tissue restrictions. This is areas where tissues do not glide. It impinges, it crushes, it pulls, it twists through things like nerves. It puts pressure on pain-sensitive structures in the immediate surrounding area. The researchers are aware of this, and they see it as a complicated problem in order to test for, analyze, and figure out and understand when they're trying to answer that question, can it lead to more chronic pain afterwards? But we, myofascial skilled expert therapists, we see a different factor that they're not even asking about yet. They're not even considering. And that's when there is surgery, scars, damage to the tissues. Yes, all those things within that area might be troubled. Yes, all the direct things, like when they crack open ribs and move them, kind of a nasty sort of thing to picture. But that leads to problems inside the muscles, that leads to problems inside the nerves that were affected directly. But what we see is when there's a fascial tissue restriction, this area, this scar tissue, no longer glides very well. It is shortened and pulled, and it leads to an overall whole bodysuit bunching, twisting, compressing. That leads to problems elsewhere that will never, ever be related to that surgery. And yet, it is a direct result afterwards. This, combined with the other factors that go on through your life, the other events, the other incidents, the other injuries, the other stresses, your body gets shorter and twisted and compressed and glued and stiff, and things starts to break down and have trouble. You'll have rib problems as they get pulled and shifted. You'll have nerve impingement issues as they get pinched or as they don't glide where they should glide. You'll have organ issues where things have been stiffened. You'll have circulatory problems, breathing problems. All of this structure is supposed to glide through your whole body so that things can function as they should, so that they're not having undue excessive pressure and tension and twisting put on them. Pain can result from surgery in a variety of ways that will never, ever be directly attributed to that. But surgery is one more factor in what your body is having to deal with. I hope that helps.